I do have a question, Hoang. In regards to a patient like following a Tenolysis, how often do you recommend for them to do therapy, and how soon after their surgery?
Okay, so there's kind of two answers, right? There's a textbook answer and then there's my answer. So I'm going to tell you what the textbook answer says. The rehab of the hand, if you follow the Wallen, like the early active whatever protocol, their idea is you don't want to do anything until like after day 5 because of healing, and there's so much inflammation. You want that to go down a little bit. So from a technical standpoint, you want to you don't want to start them too early, right? And then after that, you go into therapy and you do like, you know, I don't think the textbook tells you I don't think the textbook tells you like how many days a week, but they just say like that you should, that patient needs to go into therapy to get the movement, right? Now, my perspective on a Tenolysis is, if you already got stuck the first time, why would you not give yourself the best possible chance of getting great recovery after a second surgery, right? Because you don't want a third one, do you? Like, that's my reasoning. And then the first 2 weeks, you're really painful, you are healing, you have edema, it hurts, right? So and as your wound heals, you're gonna get tighter in the second 2 weeks, right? So my recommendation is, I like to make a very aggressive recommendation for a Tenolysis, and that's to come into therapy daily for the first 4 weeks, right? So whether you come in post-op day 1 or 2, there are things that you can do to help to manage the edema, to help wound healing, and also to promote movement without being very aggressive to that particular area. Let's say we're talking about the PIP, we're talking about the MP, we're talking about the wrist or something like that. There are things that you can do to help decrease the edema, to help with wound healing, to start specific range of motion in specific directions so that you can be looser, and then do therapy daily to get the best possible results after Tenolysis. And one of the reasons I make that really strong aggressive recommendation is because I've worked with people where they have come in for Tenolysis and we stick with the doctor wrote 3 times a week. Well, do you know why doctors write 3 times a week? Sometimes they write 3 times a week out of habit, because they write 3 times a week for everything. There's doctors that write just 2 times a week, and they write that out of habit, or whatever their perception or assumptions are about that person. If I'm working with somebody and I evaluate them and I get a story and a history of what they tell me, then I'll make that recommendation based on what I see. And majority of the time, I'm gonna tell you right now, majority of the time after Tenolysis, it's 5 days, 5 days a week for the first month. And if you can't do for the first month, let's assess where you are after 2 weeks. But here's what happened. I was working with several people. They came in every day for the first 2 weeks, and they felt really good, and they had great range of motion. And they're like, because I'm doing so well, I'm gonna stop coming as often, right? But guess what happens? Because you have this perceived notion that you're doing so well, you stop doing the thing that you need to do as effectively, as frequently as you need to. And then guess what happens? The healing part, you're loosey-goosey, right? The tendons, everything's moving because you're healing. By the time you have full wound closure, guess what happens? The scar, which is the nature of the injury, starts to tighten up, right? Starts to tighten up, and the fibers start to harden as it heals. And guess what? Now you're like, I don't need to come as often, but that is the most crucial part, right? So between the first 2 weeks and the second 2 weeks, they're most crucial part, I think. And then as you get better and you see the results, you feel the results, you feel less pain, you see the wound healing, you see the edema going down, you see the motion, now you can do more stuff on your own, right? Now, not everyone. So if I have the capacity to say, well, you're doing so well, I would hate to see you lose that motion. I would hate to see you lose that progress, because I know who you are. I know how you are. So if I have someone who is not really doing shit on their own, they're gonna need to come in more often, right? But if they're like, Hoang, every 2 hours, I'm doing it, then you don't need to come in that often, right? So it is not a cookie cutter program that you as a therapist create. It's created for your patients, how they present to you and what stage they're presenting to you, what their capacity is. But regardless of whether they can afford it or not, it's your responsibility to share your perspective of why they should be doing what they should be doing based on what you see in that evaluation, based on what you see at that reevaluation every week on week, right? Don't make assumptions about what people are willing to pay and what people are not willing to pay, what people are willing to do with their time and what they're not willing to do with their time. Present the two things and tell them what the consequences are. Because the consequence of you not coming in and you not getting the results that you need is that you're gonna get stuck again, right? And you're gonna be in pain again. And do you want that third surgery? Because some injuries, there is no third surgery. You are stuck with what you've got. So how are you presenting, how are you speaking to your people, and how are you sharing your perspective of what works and what doesn't work and why? All day, every day.
Hey therapy friends, it's Hoang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.